Good afternoon. Thank you so much for the opportunity to present our work. My name is Jeff Choi. I'm a general surgery resident and a graduate student in biomedical informatics. We're really excited to present our work on national ground transport access to trauma centers. Hospitals with specialized capacities to care for injured patients are called trauma centers. The American College of Surgeons verifies trauma centers from level 1 to level 4. Level 1 trauma centers have the highest capacity to manage injured patients, while level 4 centers have lower capacity to manage injured patients. Today, it's unclear exactly how many Americans have timely access to trauma centers or access within 60 minutes. We aim to evaluate national trends and disparities in trauma center access from 2013 to 2019. We first extracted verification levels and addresses of every US trauma center per year from 2013 to 2019. We then extracted demographic data of approximately 200,000 census block groups. A census block group is the smallest geographic unit delineated by the US Census. So these are much smaller regions than a county. Using Google Maps application programming interface, we geocoded the exact location of every US trauma center and the population center of every census block group in the US. Using ArcGIS software, we were able to calculate ground transport time, or time it takes to travel by car from a census block group to the nearest trauma center. And we did this computation for every single census block group in the United States. What ArcGIS allowed us to do was to actually account for every unique road's speed limit and average driving time. So the ground transport time that we calculated reflects real driving conditions. We defined time to trauma center as the computed ground transport time plus 17 minutes. We added 17 minutes to account for pre-hospital time. So the time it takes for EMS to arrive to the scene of injury and to triage patients at the scene of injury. Let's look at our results. Let's first look at access to level 1 and 2 trauma centers, or the highest capacity trauma centers. Going from 2013 to 2019, we see that overall, the US population has seen an increase in access to a trauma center. So a higher proportion of patients have access to trauma center within 0 to 30 minutes and 30 to 60 minutes. Now looking at all trauma centers, it's level 1, 2, 3, and 4, we see a similar trend where access has increased overall from 2013 to 2019. Let's look specifically at the numbers. Compared to 2013, approximately 7% of the US population gained access to a trauma center within 30 minutes. For level 1 and 2 trauma centers specifically, approximately 6% of the US population has gained extremely timely access to one of these trauma centers. This 2.3% indicates that compared to level 1 and 2 trauma centers alone, level 3 and 4 trauma centers provide access to a trauma center for 2.3% of the US population within 30 minutes. Now let's look specifically at some demographic statistics for 2019. Looking at these two standardized mean differences, we see that among individuals with access to a trauma center within 30 minutes, 30 to 60 minutes, or over 60 minutes, there isn't a significant difference in age or per capita income. But we do note some differences when we look at the racial breakdown. It's important to note that among Native Americans, over half, or 52%, do not have access to a trauma center within 60 minutes. At the very bottom, compared to 2013, in 2019, across all racial groups saw an increase in access to trauma center within 60 minutes. What are our findings? Between 2013 to 2019, access to trauma center has overall increased. Level 3 and 4 trauma centers provide timely access to a trauma center for 10 million more Americans than level 1 and 2 trauma centers alone do. Now, unfortunately, Native Americans have poor timely access to trauma centers. And despite the overall improvement in trauma center access, in 2019, 100 million Americans, that's nearly a third of the population, lacked access to a trauma center within 60 minutes. So what are the next steps? We really need to strategize how to improve timely access to a trauma center for these 100 million Americans. We also need to better evaluate and quantify the role of air transport for potentially improving access to a trauma center for the US population. Thank you so much for your attention today.